Today, we're diving into a rare but important topic for surfers and sports medicine enthusiasts alike: surfers' neuropraxia. This uncommon injury affects the saphenous nerve and is most often seen in those who spend hours paddling out on their boards. While surfing is known for its thrills and connection with the ocean, it can also bring about unique health challenges. Understanding these rare injuries not only helps athletes stay safe, but also highlights the importance of awareness in sports medicine. In this video, we'll explore what surfers' neuropraxia is, how it happens, and what you can do to prevent and manage it. Let's get started by looking at the basics of this condition. Surfers' neuropraxia is a rare nerve injury that specifically targets the saphenous nerve. This nerve runs along the inner thigh down to the ankle and the arch of the foot. The injury occurs due to persistent compression of the nerve, usually when a surfer is paddling prone on their board or sitting upright while waiting for a wave. The pressure from the surfboard against the medial thigh can lead to temporary nerve dysfunction, causing discomfort and sometimes pain. While it's not a common injury, it's important for surfers and healthcare providers to recognize the signs early to ensure proper care and recovery. Mechanism behind surfers' neuropraxia is all about repeated pressure. When surfers paddle out, they often lie face down on their boards, pressing the inner thigh against the hard surface. Sitting upright on the board while waiting for waves can also compress the same area. Over time, this pressure can irritate or compress the saphenous nerve, leading to symptoms. It's a subtle process, and many surfers might not even realize what's happening until the discomfort becomes noticeable. Understanding this mechanism is key to both prevention and early detection. Symptoms of surfers' neuropraxia can be quite nonspecific, which sometimes makes diagnosis tricky. Most commonly, individuals experience pain in the medial thigh. This pain may or may not radiate along the path of the saphenous nerve, affecting the inner leg, ankle, or even the arch of the foot. Some surfers might notice tingling or numbness, while others simply feel a persistent ache. Because these symptoms can overlap with other conditions, it's important to consider the context, especially if you're an active surfer. Diagnosing surfers' neuropraxia involves a careful clinical assessment. One useful tool is the saphenous nerve tension test, which can help reproduce the symptoms and confirm the diagnosis. During this test, a healthcare provider gently stretches the nerve to see if it triggers the familiar pain or discomfort. This targeted approach helps differentiate surfers' neuropraxia from other causes of thigh or leg pain. Early and accurate diagnosis is essential for effective management and a speedy recovery. Good news is that surfers' neuropraxia is generally a benign condition and can often be managed conservatively. Most cases improve with rest and by avoiding activities that put pressure on the nerve. Conservative management might include physical therapy, stretching, and modifying surfing techniques. In rare, persistent cases, a local anesthetic injection may be considered to relieve symptoms. The focus is always on minimizing nerve compression and allowing the body to heal naturally. Prevention is always better than cure, and the authors of the study proposed the Obana plan, summarized by the acronym WATER: wetsuits, abduction, timing, exercise, and rest. Wearing wetsuits can provide extra cushioning, while abduction refers to keeping the thighs slightly apart to reduce pressure. Timing your sessions and taking breaks, along with regular exercise and adequate rest, all play a role in keeping the saphenous nerve safe. These simple strategies can make a big difference for surfers who want to enjoy the waves without worry. Raising awareness about surfers' neuropraxia is crucial, not just for surfers but also for coaches, trainers, and healthcare professionals. Early recognition and intervention can prevent prolonged discomfort and help athletes return to their sport safely. By understanding the risks and symptoms, the surfing community can foster a culture of safety and proactive health management. This also encourages more research and better support for those affected by rare sports injury. Wrap up: surfers' neuropraxia is a rare but manageable condition that highlights the unique challenges athletes face in water sports. With proper awareness, preventive strategies like the Obana plan, and timely treatment, most surfers can continue enjoying their passion without long-term issues. Remember, listening to your body and seeking help early are key to staying healthy and active. Thanks for joining us as we explored this fascinating topic in sports medicine. Stay safe and see you on the next wave.